My name is Nombuso Mathe. I'm an ophthalmologist and the current acting academic head of the Division of Ophthalmology at the University of KwaZulu-Natal, the School of Clinical Medicine. I'm also a glaucoma specialist and Vice President of the South African Glaucoma Society. I'm also the president and a founding member of Women in Ophthalmology South Africa, which really is an organization trying to champion female ophthalmologists in our community in South Africa. Glaucoma is a very challenging disease, really what we call the silent thief of vision. And primarily it's a disease that affects the nerve of the eye, and it's an incurable disease. It's a progressive disease. There's a lot of research around various aspects, pathophysiology as well as treatment, but we still remain not able to cure. And essentially what happens is there's a progressive change and damage of the optic nerve, which results in a change in vision and of course functioning. And that the main risk factor really is an increase in the pressure in the eye. So most patients will often hear that we focus on the eye pressure. That's really because it's a significant risk factor. And there's multiple treatment strategies that are available, remembering that none of these treatment strategies cure the disease, but certainly can control the disease process, allowing us to be able to help a patient retain and maintain their vision. My current areas of interest really are a little bit diverse, but the two focus areas are in medical education, where I'm currently looking at surgical training, and in not specifically just ophthalmology, but general surgical training, and some of the ethical issues related to how we conduct this type of training and education. And really an area that requires a lot of looking into, really because we don't often have discussions around ethics when it comes to medical education. So this is my main area of focus in terms of research, and really as a leader in ophthalmology education and trying to raise the next generations of ophthalmologists in this country, in South Africa, which is again something that I'm deeply passionate about. The other area of research involves my area of passion and subspecialty training. So I'm trained as a glaucoma specialist. I completed my training at Moorfields Eye Hospital in the United Kingdom. I also do have a background in postgraduate research training with the Harvard Medical School. And so in this area of glaucoma surgery research, my focus is really on angle-based surgery, which is a type of techniques of surgery that are not often practiced in the context of the African patient. And so there's a lot of growing and learning that can happen potentially in that space. One of the things that I'm mostly passionate about really is in teaching. I do both undergraduate, fourth and fifth year teaching, as well as postgraduate, and that's really the primary area of focus, is the postgraduate teaching of registrars, and recognizing that ophthalmology is such a rapidly advancing, probably the field that has advanced the most over the last 10 to 20 years, especially from a technology perspective. So there's a lot of growing in that space, and as we know that in low to middle income countries like ours, advancements tend to be a little bit slower, and so with the advent of AI and that sort of thing, we need to really start being intentional about keeping up with the changes that are happening in the world. And really it just makes our lives and our work a little bit better and more efficient, and the end point really is to be able to raise the standard of care for our patients, especially those that are most indigent and those who already struggle with access to this level of skill.